Well, we're nearing the end of another hectic week for the White House. So as the Senate gears up for its own healthcare showdown, let's take a quick look back at the week that was. The White House launched its Tech Week on Monday with a rare public speech from the president's son-in-law and senior advisor, Jared Kushner. The speech garnered quite a lot of headlines, but the president was making headlines of his own, tweeting last weekend that he is being investigated for firing FBI Director James Comey. Then on Tuesday, the White House said the president was looking forward to a health care bill with, quote, heart. The president was also looking forward to Republican victories in a pair of special elections, and he got them, the biggest of which coming from Georgia's 6th district, a district the president himself won by only 1 point last fall. By Wednesday, Kushner was in the Middle East working to broker a peace deal between the Israelis and Palestinians, and Mr. Trump went west of the Mississippi for the first time in office.
You know, I've been watching, and they're saying, President Trump has not produced health care. You know, I've been there for 5 months.
He rallied his base in Iowa and beat the drum yet again, proclaiming that Obamacare was failing. Then on Thursday, the president finally cleared up the most obvious question about alleged Comey tapes, saying he had none. And Senate Republicans released their version of the bill to repeal and replace Obamacare, but not every Republican lawmaker is on board. Within hours of its release, 4 of them came out against the bill, saying it doesn't go far enough to overhaul its predecessor. And now another Republican senator says it perhaps goes too far.
My point of being here today is to tell you that this bill that's currently in front of the United States Senate, not the answer. It's simply not the answer. And I'm announcing today that in this form I will not support it. Barring significant changes from the Congressional Budget Office, this bill will mean a loss of coverage for millions of Americans and many Nevadans. I'm telling you right now, I cannot support a piece of legislation that takes insurance away from tens of millions of Americans and hundreds of thousands of Nevadans.
Eric Levitz is an associate editor for New York Magazine's Daily Intelligencer, and he joins us now to break this all down. So let's first start with Senator Dean Heller there of Nevada, who really is concerned about his constituents losing their Medicaid coverage. And we also know he is up for re-election. So what do you think here? Do you think that there are going to be other GOP senators that could potentially come out against this bill in the next week for this same reason?
Yeah, I mean, Heller is a really interesting case because he is probably the most vulnerable GOP senator up for re-election in 2018. The Democrats generally are more vulnerable on the Senate map in 2018 than the Republicans are. But he's from a blue state. He's from a blue state that expanded Medicaid, that covered 200,000 more Nevadans got health care since the Obamacare law went into effect. And it's got a Republican governor who has come out in favor of the Medicaid expansion. So that puts him in a unique bind. He's not actually the most moderate senator in the body generally. He voted to repeal Obamacare completely when there weren't actual stakes to it because they knew that Barack Obama would veto it. Mm-hmm. So what I think is important about his remarks today is that he wasn't vague about what he didn't like about this bill. He said, I can't vote for a bill that puts tens of millions of people off of their health insurance. Based on the CBO score for the House's bill, which is very similar to the Senate one, this legislation is going to rob millions of people of their health insurance. So that is, a deal breaker. And if he is going to flip-flop on that, he just gave an excellent soundbite to his Democratic challenger. So he's really put himself in a bind where it's going to be very hard for them to push him back into the yes corner.
How do you see this bill really shaking out here? What is it going to look like if it's going to pass?
Yeah, I mean, it's fascinating because we had this pattern in the House where, when this bill was first unveiled in the House, you had moderate Republicans saying, well, these Medicaid cuts are unacceptable, what this does to pre-existing conditions, whatever, it's unacceptable. And then as soon as it got to the point where the conservatives, the far-right conservatives who think this doesn't go far enough, once they got on board and the moderates were all by themselves, the only force that's keeping this from going into law, they got scared of those ads, and they got scared of the prospect of those ads, and they got scared of being tagged as the ones who kept this from passing. So the question is going to be for senators like Lisa Murkowski in Alaska, which really has a lot to lose from this because Alaska is a rural place with not a lot of health care options. They're going to really see their health care go up. So what's going to happen from now? We've got Rand Paul, who is opposing this from the right. He sounds like he's not on board. You've got Heller. He's not on board. They lose one more, and they're dead. So at this point, it's a bidding war. Every one of those Republicans that are on the fence, Lisa Murkowski can ask for all kinds of crazy pork for Alaska right now. Right? If she wants a bridge built, if she wants, I mean, right now is when the candy starts getting handed out.
Interesting.
So the question is whether once they start handing out all this like pork and candy, whether the conservatives bolt, because that's the sort of thing they've been running against, government waste and handouts.
So is that a strategy then?
That's going to be part of the strategy. And we saw this in the House, actually, where to get the upstate New York delegation on board, they did this thing called the Buffalo buyout that changes the way that New York distributes its Medicaid in a way that's advantageous to a couple counties upstate. But so we're going to see a version of that in the Senate.
All right, so finally, just switching gears a little bit, looking ahead to next week, Supreme Court is potentially going to decide whether or not it will take up the idea of this travel ban here. What do you think about that? Obviously, it hasn't fared well at all in the court system. What do you think is going to happen? And really, how big of a blow would it be for the White House if the High Court decided, no, we're not going to take this up?
Yeah, at this point, they've taken so many blows from that travel ban thing that I think if they are able to just let it fall away and have people forget that it ever happened, I don't know that it's that bad for Trump. What the Supreme Court is really deciding right now is the administration wants them to let them enforce the ban right now and talk about the case in October when they get back in session. The Supreme Court, if they did that, essentially the Trump administration would just get to do their policy, because the travel ban was a time-limited ban. It was a 90-day ban while I think Department of Homeland Security reviewed the procedures for vetting and determined whether or not is there a way that we can vet the people who are coming in from these specific countries. Well, if this is allowed to be enforced, and then they talk about whether or not it was constitutional in October, they will have done their policy, their potentially unconstitutional policy, by the time they hear about it in October. So what's really at stake right now is whether or not the Supreme Court believes it needs to defer to the administration before they take it up, or whether they need to keep the injunction that's been put on it in place until they hear it. The other wild card possibility is that the Supreme Court could decide, you know what, this is so important, we're going to put off our recess and hear it right now.
Oh, wow.
These guys
What's the likelihood of that?
They have teaching appointments and they have vacation plans and they have families, and I'm not so sure that that's going to happen, but we'll see.
All right. Eric Levitz, Associate Editor for New York Magazine's Daily Intelligencer. Thank you so much.
Thank you.